being so sensitive to touch that even your clothing causes extreme pain. Or think about the most tired you've ever been, and that feeling doesn't go away. This is what life can be like for people suffering from fibromyalgia. Welcome Mary Harper and Toby Robbins to the show. Also, neurologist Dr. Pamela Blake of Memorial Hermann Northwest and psychologist Dr. Roberta Diddell, and we'll talk to them in just a couple of minutes. When I first met you, probably about 8 years ago, fibromyalgia was this thing that no one really understood. And you had so many people saying, I have this thing, I don't care what you call it, I'm still suffering. And people would look at you and say, look, just, you know, it's in your head.
That's right, that's right. We had people come by and say, I've been to 10 doctors. They all tell me that I need a psychiatrist, but I hurt. And there's really something wrong with me. And this was back when 18 years ago, you didn't walk into Barnes & Noble and see books on fibromyalgia and open up...
It was a mystery.
Or open up Good Housekeeping magazine and see a one-page ad. These people were alone, and they really began to think that maybe they were going crazy. They hurt, the pain moved around. They'd go to the doctor and say, well, my arm hurts, and then yesterday my leg hurt, and then I felt like I had the flu, and the doctors would do this and say, well, you know, are you having problems at home?
Yeah, exactly. But then I would see articles that would say, you know, kind of a made-up disease. As opposed to made-up disease, what it was, I guess, is it's, as Jamie mentioned earlier, an umbrella for something that, a bunch of symptoms that people don't understand.
That's true. Exactly. And we would find that you had fibromyalgia along with other illnesses. And they could diagnose the arthritis, and they could diagnose the lupus, but they didn't have a clue as to the fibromyalgia. Ladies, we now have validation. We're not crazy.
You see? I'm not. Yeah, and it's because people like you all kept fighting. Give us a sense of what you feel like and how it first started for you.
I think I've always had it, even when I was a child. And it's not diagnosed very often in children, but I never could keep up with my peers. I can still remember the gym teacher yelling at me, do you smoke? No, I don't smoke.
I'm only 5.
I can't run, but you know, and I would come home and just collapse after school. And I would grow and got married and had kids, and the kids didn't understand why I didn't want to play with them very much because I just didn't have the energy. I'd come home from work, I'd collapse into bed. I would hurt all the time. My poor husband would say, I can't even hug you, and that is one thing that is really devastating with people's relationships. I was very, very lucky with my husband. He was very understanding about it, and he would say, am I hurting you? And I'd say, oh, actually, yeah.
But to not even be able to hug, and then, you know, we've heard so many stories. I think when I first met you, it was just even the clothes on your skin, feeling the air from the ceiling fan. That's how sensitive it could be.
It would trigger one muscle to go into spasm, and that muscle would talk to all the other muscles, and the whole body would just... You couldn't move.
Right. What gets you out of bed today?
I'm lucky. I have good medication. I'm on one of the 2 medications that are approved for the treatment of fibromyalgia. That's been a huge step for us when the FDA approved 2 medications. That gave us a lot of validation. That helps me a lot. I exercise. I think it's extremely important. People with fibromyalgia hurt a lot, so you don't feel like getting up and getting out of bed and moving.
That's good for your immune system.
You've got to move. You've got to. In fact, that's one of the things we've done is to produce our own little exercise video.
I talked earlier about a friend of mine, Dr. Pamela Blake, who suffers from migraines and headaches, and it is debilitating. I hurt for her. Her little boy, when I first met him, was 2 years old. He's now 18, and he says, my whole life, I remember basically half my relationship with my mom is her laying in a dark room. And she lost jobs because of it, a big strain on their marriage. Anything on the horizon to help people deal with it?
Yes, and I treat patients with headaches, and a lot of people with headaches do have migraines. There's a lot of confusion in the headache world and even among lay people. Migraines are actually a treatable cause of headache. They tend to be intermittent, but for the chronic daily headaches that are present most of the time, there's a growing belief that these headaches are due to pressure on nerves in the back of the head and in the front of the head. And there are surgical procedures that can be done to remove the pressure on those nerves, like a carpal tunnel type of procedure. And that's been very helpful. And like fibromyalgia, this is an area where there's been a lot of confusion and misdiagnosis, and everything that your guests have talked about so far apply to the headache patients also.
Yeah, and Dr. Diddell, You heard us talking about earlier how when someone's in pain, at first you go, oh, can I get you something? Oh, and then it becomes okay, that one over there, or, problem child, and then it becomes a problem for the person who's suffering from that pain because you don't want it. You want to be productive, and so it causes depression. It causes so many other things.
You can be very isolated, I think, and that can turn into a feeling of alienation from other people. It's difficult to manage, and some people do better with it than others. I had a spinal cord injury myself and have chronic pain, and when I first started my experience as a psychologist, I started running a pain clinic and noticed that some people do better than others, and it made me curious, why can I manage with this and other people don't do as well? And I did my dissertation on it. One of the things that, the simplest way to describe it is that some people are born poo, and some people are more like Eeyore. Pooh is like, oh, wasn't it a wonderful day? It's so beautiful. And Eeyore goes, I don't know, it's kind of sunny to me.
Yeah.
And anybody who has had more than one child knows that kids come out different.
Right.
And so we each temperamentally come out a little bit different. And your temperament can make a difference. It can mean whether you're prone to become depressed with the pain or whether you can be more resilient and
as Money was saying, who's sitting next to you, who said, I make up my mind the night before that I'm going to get up tomorrow, I'm going to get dressed, and I'm going out into the world.
And managing pain is something like ignoring a broken doorbell. If the doorbell rings, you go down to see who's there, and there's nobody there. So you go back upstairs and you're working on things, the doorbell rings again, there's nobody there. How many times do you go down and answer the doorbell until you figure out it's broken? And with chronic pain, pain is meant to be a signal that something's wrong, and so we pay attention to it.
And we treat the symptoms too often.
Being able to manage means being able to put it in the background and not pay attention to it. The doorbell's ringing, but I'm not going to answer it. I'm going to be focused on my work or my children or the things that are important to me and ignore the doorbell that's broken.
Yeah. Ladies, thank you very much. And we know that there are support groups out there for people dealing with fibromyalgia and different types of pain. And we'll have more information on these organizations. You can go to our website, greatdayhouston.com. Coming up, it can be a thin line between pain relief and addiction. When we come back, managing pain without going over the edge.